Hey guys, today's What's the Case with Dr. H, and we've had a couple of questions sent out to us about breast cancer. Obviously, this is October, so it's Breast Cancer Awareness Month, and one of the very important questions that we get asked often is, can I get pregnant after breast cancer? And for sure, there are obviously very different cases. The majority of situations that we see with today's screening methods is that we catch breast cancer at a very early stage that require only surgery and no other intervention like radiation or chemotherapy, which can definitely affect a woman's fertility. In those cases, it's very easy and the fertility has not been altered in any way, shape, or form. However, there are situations where women have to be exposed to not only the surgery, but the chemotherapy as well. And depending on the radiation, depending on the diagnosis, and depending on how many cycles of chemotherapy they require, it may be altered. So always we have a very significant conversation with your oncologist regarding the different options, and certainly fertility preservation by means of either egg freezing or embryo cryopreservation are the means where we do this before any therapy is undertaken with the breast cancer. So the question is to talk a little bit more about fertility preservation in the presence of a diagnosis of breast cancer. So definitively, the options that are available to patients are a little bit broader than they used to be. 10, 15 years ago, when somebody was diagnosed with breast cancer, the oncologist was always hesitant to refer somebody to a fertility specialist for the purposes of freezing their eggs, and certainly freezing embryos, which were not even available necessarily back then in the way that they are today, and with the success rates that we see in 2022. Nowadays, after many conversations and many studies that have been made available to us, we know that it is perfectly okay, regardless of the diagnosis or the type of breast cancer, to be able to refer somebody to a fertility specialist immediately for either freezing their eggs, which is a process that takes anywhere between 7 to 10 days, or embryo cryopreservation when the patient has a partner. These embryos can be kept in perpetuity for them to undergo subsequent treatment, surgery, and the length of time where tamoxifen therapy is generally used, which can be anywhere from 5 to 10 years, depending on the age of the patient. So for all you survivors out there, congratulations. For all of you that have been diagnosed recently, we're very sorry, but you know that there are options, and you're gonna beat this.